The term narcotic originally referred medically to any psychoactive compound with any sleep-inducing properties. In the United States it has since become associated with opiates and opioids, commonly morphine and heroin and their derivatives, such as hydrocodone. The term is, today, imprecisely defined and typically has negative connotations. When used in a legal context in the U.S., a narcotic drug is simply one that is totally prohibited, or one that is used in violation of strict governmental regulation, such as codeine or morphine. From a pharmacological standpoint it is not a useful term, as is evinced by the historically varied usage of the word. Alcohol is the principle that gives to ardent spirit and wine their intoxicating power. While the narcotic principle to opium and tobacco imparts similar properties. In popular language, alcohol is classed among the stimulants, and opium and tobacco among the narcotics, which are substances whose ultimate effect upon the animal system is to produce torpor and insensibility. But taken in small quantities they at first exhilarate. And since the alcohol does the same, most medical writers, at the present day, class it among the narcotics. Edward Hitchcock, American Temperance Society. Statutory classification of a drug as a narcotic often increases the penalties for violation of drug control statutes. For example, although federal law classifies both cocaine and amphetamines as Schedule II drugs, the penalty for possession of cocaine is greater than the penalty for possession of amphetamines because cocaine, unlike amphetamines, is classified as a narcotic. United Nations, Single Convention on Narcotic Drugs, 1961, the adoption of this convention is regarded as a milestone in the history of international drug control. The Single Convention codified all existing multilateral treaties on drug control and extended the existing control systems to include the cultivation of plants that were grown as the raw material of narcotic drugs. The principal objectives of the convention are to limit the possession, use, trade, distribution, import, export, manufacture and production of drugs exclusively to medical and scientific purposes and to address drug trafficking through international cooperation to deter and discourage drug traffickers. The convention also established the International Narcotics Control Board, merging the Permanent Central Board and the Drug Supervisory Board. The 1961 convention exercises control over more than 116 narcotic drugs. They include mainly plant-based products such as opium and its derivatives morphine, codeine and heroin, but also synthetic narcotics such as methadone and pethidine, as well as cannabis, coca and cocaine. The convention divides drugs into 4 groups, or schedules, in order to enforce a greater or lesser degree of control for the various substances and compounds. Opium smoking and eating, coca leaf chewing, cannabis resin smoking and the non-medical use of cannabis are prohibited. The 1972 protocol to this convention calls for increased efforts to prevent illicit production of, traffic in and use of narcotics. It also highlights the need to provide treatment and rehabilitation services to drug abusers. Incb Yellow List. This document contains the current list of narcotic drugs under international control and additional information to assist governments in filling in the International Narcotics Control Board questionnaires related to narcotic drugs, namely, Form A, Form B and Form C, UNODC terminology and information on drugs. In medicine, a chemical agent that induces stupor, coma, or insensibility to pain. In the context of international drug control, a narcotic drug means any drug defined as such under the 1961 Convention. World Health Organization, studies on the definition of counterfeit medicines in WHO member states, 4. Assessment of the definitions of counterfeit medicines in member states, 4.2 The nature of legal definitions, the unambiguity requirement. In order to avoid room for difference in interpretation, lawmakers sometimes deviate from etymological definitions. In doing so, they approach the term from the law enforcement point of view. The best example is the definition of narcotics in the United Nations conventions. Narcotics are substances and preparations that induce drowsiness, sleep, stupor, insensibility, etc., and that these effects are complicated to prove, for example during litigation. Thus, the legal definition of a narcotic is whether or not it is listed on the schedules of the convention. If it is on some of the schedules, it is narcotic. Lexicon of alcohol and drug terms published by the World Health Organization, the term usually refers to opiates or opioids, which are called narcotic analgesics. In common parlance and legal usage, it is often used imprecisely to mean illicit drugs, irrespective of their pharmacology. For example, narcotics control legislation in Canada, USA, and certain other countries includes cocaine and cannabis as well as opioids. Because of this variation in usage, the term is best replaced by one with a more specific meaning. United States Code of Federal Regulations, Section 1300.01 Definitions relating to controlled substances. B. As used in Parts 1301 through 1308 and Part 1312 of this chapter, the following terms shall have the meanings specified. 30. The term narcotic drug means any of the following whether produced directly or indirectly by extraction from substances of vegetable origin or independently by means of chemical synthesis or by a combination of extraction and chemical synthesis, i. Opium, opiates, derivatives of opium and opiates, including their isomers, esters, ethers, salts, and salts of isomers, esters, and ethers whenever the existence of such isomers, esters, ethers and salts is possible within the specific chemical designation. Such term does not include the isocyanyl alkaloids of opium. E. Poppy straw and concentrate of poppy straw. E. Coca leaves, except coca leaves and extracts of coca leaves from which cocaine, esconine and derivatives of esconine or their salts have been removed. If cocaine, its salts, optical and geometric isomers, and salts of isomers. B. Esconine, its derivatives, their salts, isomers and salts of isomers. Vi. Any compound, mixture, or preparation which contains any quantity of any of the substances referred to in paragraphs 31, I, through of this section. A 1984 amendment to 21 U.S.C., Section 802 expanded and revised definition of narcotic drug, including within term poppy straw, cocaine, and esconine. U.S. v. Steeran, 608 F2D 1135, United States Court of Appeals, 8th Circuit. Decided October 31, 1979. Lay, Circuit Judge. John Arthur Steeran appeals from the judgment of conviction for possession of cocaine with intent to distribute and dispense under 21 U.S.C. A Section 841, A, 1. Steeran contends that the statute is unconstitutional because cocaine is classified as a narcotic under Schedule 2 of 21 U.S.C. A Section 812, C. When as a matter of scientific and medical fact cocaine is not a narcotic but is a non-narcotic stimulant. The sufficiency of the evidence is not disputed. Steeran was convicted after special agents testified that he was in possession of and attempted to sell them a large quantity of cocaine. Defendant urges that the testimony and reports by physicians and scientists demonstrate that cocaine is not a narcotic. He also cites cases which hold that cocaine is not a narcotic under the pharmacological definition of the term. State v. Erickson, 574 pages 2d1. It is within the legislative prerogative to classify cocaine, which is a non-narcotic central nervous system stimulant, as a narcotic for penalty and regulatory purposes. 21 U.S.C. A Section 802, 16, A. The use of cocaine poses serious problems for the community and has a high potential for abuse. Congress' choice of penalty reflects a societal policy which must be adhered to by the courts too. Congress has the power to reclassify cocaine. This power has been delegated to the Attorney General. 21 U.S.C. A Section 811, A, 1. If cocaine is to be reclassified, defendants' arguments should be made to the legislative branch, not the courts. We hold that Congress had a rational legislative purpose when it classified cocaine as a Schedule II narcotic drug for the purpose of imposing penalties. Judgment affirmed. History. The term narcotic is believed to have been coined by the Greek physician Galen to refer to agents that numb or deaden, causing loss of feeling or paralysis. It is based on the Greek word I plus or minus II permyliflorin I to the first I, the term used by Hippocrates for the process of numbing or the numbed state. Galen listed mandrake root, alticus, seeds, and poppy juice as the chief examples. It originally referred to any substance that relieved pain, dulled the senses, or induced sleep. Now, the term is used in a number of ways. Some people define narcotics as substances that bind at opioid receptors, while others refer to any illicit substance as a narcotic. From a legal perspective, narcotics refer to opium, opium derivatives, and their semi-synthetic substitutes. Though in U.S. law, due to its numbing properties, cocaine is also considered a narcotic. Sense of any illegal drug first recorded 1926, Amareng. The ADJ is first attested c. 1600. Analgesics. Analgesics are drugs that relieve pain. There are two main types, non-narcotic analgesics for mild pain, and narcotic analgesics for severe pain. See also. Opiate comparison, Narcotics Anonymous, narcoterrorism, prohibition of drugs, references. External links, pharma.org, a non-profit site providing detailed descriptions of most narcotic analgesics, list of controlled substances, some of which are classified as narcotics, in the U.S. Controlled Substances Act. Not all of the classified ones are chemically narcotic, as described on the top of this page.